Hello everyone, I'm Walt Hussain, Consultant Dermatologist and Clinical Lead for the Tele-dermatology service here in Leeds. I'm here just to briefly explain about the Tele-dermatology service, why it's been set up and what we hope to provide all our skin cancer patients here in Leeds with your help. The Tele-dermatology service was set up on the basis of a pilot which we conducted in conjunction with our GP colleagues to show that sending a clinical image of suspicious skin lesions was a highly effective and safe way of allowing triage by consultant dermatologists, sifting out benign and malignant lesions. The system will work with each 2-week wait referral being accompanied by a clinical image, which includes a locator, a macroscopic image, and a close-up dermoscopy. Now, this may sound cumbersome, but we know from our partners in primary care that this whole process we've chosen and streamlined to be able to be completed within 30 seconds to a minute maximum. It was really important for us to find a solution that wasn't going to significantly impact on our primary care colleagues, and hopefully we've found that solution for you.
I'm Sarah Forbes and I'm a GP in Leeds. Today I'm going to take you through the tele-dermatology process and how to transfer images to the hospital for them to look at for any concerning skin lesion you may have. So one of the most important things about this process is that we have to get patient consent. Now that's consent for the image to be held in their patient records, but also that it will be held on a cloud and the image will be stored just with their NHS number. So that's the important point that we need to get across. And also that we make sure that we give patients an information leaflet explaining the whole process to them. So just to get consent from yourself today, so I'm going to take 3 images, one to show where the lesion is, one a slightly more close-up image, and then one using a dermatoscope, which is a bit like a magnifying glass of the lesion. Those 3 lesions will go just with your NHS number and they will sit on a cloud so that the hospital can access those images and have a look at them to make a diagnosis. Is that okay? Okay, so first of all, you have your iPod and just log into it. So just put in your passcode. You then get the Consultant Connect app. It will ask you again just to say, can you confirm that the patient's given consent? So there's a reminder there if you do forget. So I'll confirm that because you have given your consent. So the first image is going to be a locator image, just to give the consultants an idea of where this is. So we're just going to click that so they understand it's an arm. Then we just click the blue icon there to take another picture. And this one's just going to be slightly closer up, and if you just hold it steady so it will focus. Okay. And then the third one is with the dermatoscope. So you just turn the light on at the side and just lower the contact plate. Okay. This just fits on magnetically, and then the contact plate goes on the lesion this time and take the photo and then click use photo. And then from there, just type in the patient NHS number from the medical records. Okay, click next and save that. And all the photos, along with the NHS number, will automatically be transferred to the cloud. If you've got a patient with multiple lesions, then they will need to be seen in the clinic. What the consultants are asking, if you can send an image of the most serious looking lesion or the lesion that you're most concerned about for them to have a look at. But when you fill in the form, you need to flag that they have multiple lesions and they will automatically be given an appointment time. So from a primary care point of view, the next part is completing the paperwork. If you're a System 1 practice, you would go into your DART referral tool as you normally would. You fill in the paperwork for the skin 2-week wait form. You would then send a task to the secretaries for them to send the 2-week wait form and the images via the ERS system. And this is another change that you need to be aware of, that these referrals need to go through the ERS system and not emailed, which is what we currently do. The other thing to note is a new addition on the DART form will be an area to ask specifically, have we got consent to send the images of the patient through? If you're an EMIS practice, you still need to use the e-referral system, but use your normal process for sending 2-week wait referrals. So once your referral form has been completed and sent to the hospital, the responsibility will then lie with the hospital to make a decision about that patient.
When we receive the referral at Leeds Teaching Hospitals, We've agreed to triage those referrals within 48 hours of being seen by a consultant dermatologist. If the lesion is benign, we will inform the patient and yourselves within 10 days of having received that referral. That will allow the patient to be reassured quickly and efficiently, and also your records to be kept up to date. I want to be very clear here that this is a very safe service. If there is any doubt whatsoever about a lesion, that patient will be asked to come to hospital for a clinical assessment. That will also occur if the photo doesn't allow us to make a clinical diagnosis. Safety is absolutely paramount here, and that's something that we are very keen to ensure for all our patients. Just think about the benefits though. You have a patient with a benign lesion in primary care, and that saves the patient a journey to hospital, potentially time off work, and also the bane of having to find hospital car parking. Our data so far shows that the system benefits are huge. This clinically and efficient way of providing skin cancer triage. The key thing here is using the equipment that the CCG has provided for you allows consultant dermatologists to triage with great accuracy and efficiency. This is a win-win situation, hopefully for you in primary care and for us in secondary care, but most importantly for our patients. Thanks for listening.